Hello, I'm Dr. Mark Mason from Southlake Plastic Surgery in Southlake, Texas. And today we're going to talk about how to choose the right size breast implant. Implants are basically chosen depending on the patient's wishes, the patient's height and weight, as well as the breast itself. During the examination, we'll take several measurements of your chest wall as well as your breast to determine what implant might suit you the best. And these include measurements from the middle of the chest here to the nipple, and from the nipple to the midline here, as well as measurements from the nipple to the crease, which is underneath the breast. The most important measurement that we take is the width of the breast, or the breast base, because that really determines the implant, the largest implant size that can be placed. In our practice, we use mostly smooth round breast implants because the so-called teardrop implants have some other problems, and you get a really good result with just a smooth round breast implant. There's something called the moderate plus implant, which is basically an implant that's flatter and doesn't have as much projection this way, and those implants are good for some patients. There's another implant called the high profile implant. It's a more narrow based implant, but it has a lot more projection forward, and this would be a good implant for someone that has a very narrow chest wall and still wants a significant volume, because the other implants would give you a lot of fullness outside here towards the armpit, and that's not necessarily a good thing. There's a third type implant. It's an ultra high profile implant. It's very narrow and has a large amount of projection, and these are occasionally used on some patients, but not as common as the other two I just talked about. For more information about Southlake Plastic Surgery and Southlake Plastic Surgery Med Spa and the services we provide, click on the link below.